spent 14 months trying to pass the ACA, okay? We spent a long time trying to get Republicans on board. We had the Gang of Four, the Gang of Six, the Gang of Eight. We spent months doing that. I know personally, my boss, Peter Orszag, went to the Hill, met with people like Olympia Snow, brought back lists of things we had to put in the bill so that they would join. We did those things. I was responsible, among other people, for doing the things they wanted. Olympia Snow voted for the ACA in committee, and then Republicans came down on her like a ton of bricks to make her reverse her vote. There has been zero attempt by Speaker Ryan and the President to get any Democrats to get on the American Health Care Act at all. No bipartisanship at all. No even fake attempt. No Gang of Four, no Gang of Six. No, I'm going to bring you into the White House and talk to you. Zero bipartisanship. So when Paul says we need a bipartisan bill, that's certainly not the way Washington is going. In fact, Speaker Ryan has specifically excluded that. So if you think we need bipartisanship, I couldn't agree with you more. But we tried, they said no. They haven't even tried.
There was an opportunity when Paul Ryan went, and first proposed, I think, maybe it was in 2009 or 2010, premium support for Medicare, enhancing the competition there. And I think President Obama just basically stepped on it and said, you're basically trying to throw grandma off a cliff. This is terrible. But if you were to step back and say, wait, we want an exchange-like function for Medicare Advantage plans. We want more head-to-head competition. We're going to have some protections in there. So the amount of premium support seniors are going to get is going to ensure that they can buy a plan that offers exactly what the Medicare package has in it, fee-for-service. And I think that there's an opportunity there to have a discussion. President Obama could have said that and said, wait, I'm trying to do something similar in the individual market. Let's have a conversation. Because I see where you're trying to go. Let me tell you about where I'm trying to go. Let's have a serious conversation here. I think that hadn't happened. Both sides of the aisle have done that. But I think if you're going to hold up Olympia Snow or somebody else, you've got to say, what is a serious concession would have been then? And again, I think going back to something that I think everyone on this panel agrees, the real opportunities there are around productivity and competition and understanding how to drive that. States may make one decision within an essential health benefits component or in Medicare to be able to say to plans, we're not going to tell you what kind of providers you might have to use, for instance, for an obstetrics benefit. Maybe you want to use more nurse practitioners or midwives or other low-cost birthing centers, or give people more incentives to use those kind of providers. And then when you look at the data on health outcomes, there's an opportunity there for people to really choose.